you can see here that he looks refreshed. He doesn't look as sunken. He's got more of a jawline. He doesn't have all this jowl here. We gave him that structure and that pullback that he needed, like he was 20 years ago. I get DM'd frequently by men who are not willing to give comments in the comments section because they're being quite private about what they can do for their anti-aging journey. This video, we're going to talk about different strategies for that aging man in their 40s and 50s on things that they can do to prevent aging, keep collagen stimulated, and look their best and be as confident as possible in their day-to-day lives. My name is Chantal Ward, and I'm a registered nurse specializing in medical aesthetics. I am here today to give you all the information you need to make sound decisions for yourself in your anti-aging journey. So let's get started. Let's understand a little bit why there are some subtle changes in how a man ages. Aging tends to affect not only their visual appearance, but their confidence. So what I'm going to do today is give you a little bit of background why and how men age a little differently, but very similar to women, and what are the best strategies moving forward to prevent aging, keep collagen stimulated, and keep your face up. So let's start off with the basics. So if you're in your 40s and you're looking at prevention or a little bit of repair, the best avenue to take is to get on some good old-fashioned medical grade skincare. We know that men tend to have thicker skin. They tend to be a little bit oilier. For you gentlemen, you tend to have more collagen than women of the same age. So let's keep it stimulated. So what we want to do is getting on a retinol. A retinol helps with cell turnover. It boosts your natural collagen. It is so simple. It is a skincare product that you can use every 2 to 3 days at night only, and you build up the endurance to it, and you'll find that your skin will start looking like it has a little bit more luster. You'll have a little bit less pigmentation, a little bit less oiliness, maybe even a fewer number of blackheads. So that would be the first thing that I would talk to you about in adding to your skincare. The second most important thing would be a great vitamin C. A vitamin C is an antioxidant. That antioxidant helps to brighten your skin tone, give it some luster, that shine, and just look a lot healthier. Hydration. If you are a guy and you've been working outside, or you have that sailboat, or you're a cyclist or a golfer, you've got sun damage. So what we need to do is we need to make sure we are protecting your skin, but also giving it hydration. So a daily moisturizer that has great ingredients in it, that has hyaluronic acid, will keep your skin moist and healthy. And the most important thing, I find this very comical, when you tell a man, you need to wear sunblock. Oh, I never wear sunblock. Well, no, you've got it here. You need to wear sunblock every day. If you're outside 5 minutes every few hours, or you're sitting in a bay window in your corner office and you're getting sun exposure and you don't have sunblock, my friend, you are getting sun damage, and that in time will age you. Speak to your medical aesthetic provider, talk to your dermatologist, and they'll get you on the right path. Let's talk dynamic lines. So that guy that's got the 11s, or he's constantly looking angry, or he's got a bunch of forehead lines, if you're that person, then you need to listen up, and we're going to educate you a little bit about Botox, or if you want to call it Brotox. And we will spend some time now and showing you that it's okay for a guy, a man in his 40s and 50s, to get Botox. It's subtle. It's great. It makes you look refreshed. You don't need to worry about looking done. There's a lot of misconceptions on what is Botox and what are dermal fillers, and they are completely different. Botox will help with those mechanical lines or those muscles that are in constant movement. So if you have these muscles that are pulling down and giving you the 11s, or when you lift your eyebrows up, you've got these deep, deep, deep lines or crevices on your forehead, or you've got these distinguished crow's feet, we can soften those and not eliminate them completely, but by softening the muscle contractions, it will give you a more open look, a more fresh look, not an angry look, and it will be subtle. People won't even know. You need to make sure that you are going to a medical aesthetic or a healthcare provider that understands the nuances on injecting a man versus a woman. Dermal fillers for a man. This is not to volumize, unless of course you've lost volume. I know my husband, and I'm going to show you some pictures of his before and after. He had some health issues back a decade ago and has lost a lot of bone density because of the medications he's on. And not just because of medication, but men as we age start losing our bone structure, our muscles start contracting different. We have the same aging process that occurs in women, but a little bit different. So when we do dermal filler injections on men, it's more around giving them structure, support, being very subtle, providing a little bit more of a chiseled jawline, giving them their chin back, because as we age, we do sometimes see men lose they may have had a small chin to start off with, but as they age, it gets smaller. So we want to even it out to not give them those feminine lines or volume, but we're really doing it more to give support and structure. I'm going to show you here. This is one of the companies that I work with. It's called the Juvederm lineup from Allergan Aesthetics. And if you look at a male face, we tend to do more structural injections on the most lateral outer aspect of the face. So you can see when we assess, we're going to figure out where is the volume loss. Is it more structure because they've lost bone? And we give them their jaw back. Whereas with a woman, we're going to spend more time giving her volume to give her that little bit of a plump cheek. We're going to also give her a jawline, but we're not going to give her a jawline that is square. We're going to give her more of that jawline that is really more like an angle, okay? So there are differences and nuances in injecting men versus women. So to summarize, we focus on restoring the structure on men. So you'll see from the before and after pictures, these pictures that I'm showing you are immediately after injection. We are now almost 3 weeks out, and unfortunately I don't have the after picture because it's hard to get him to stay still for a minute. But he looks even better now. You can see here that he looks refreshed. He doesn't look as sunken. He's got more of a jawline. He doesn't have all this jowl here. We gave him that structure and that pullback that he needed, like he was 20 years ago. For men, not only can we look at skincare, a neuromodulator such as Botox, Xeomin, or Dysport, or a dermal filler, we will always discuss devices or laser treatments or microfocused ultrasound that builds the collagen naturally. Fortunately for my husband, he's also done all therapy. So we've done all therapy. I've done all kinds of laser treatments on him to really restore as much collagen as possible. And I will always combine this with an injection if it's appropriate for that male client that's coming in for a consultation and treatment. All of these things help boost and build new collagen. And that's how we manage someone who's in their 40s and 50s that's trying to sustain that youthful look, that structured look, not lose volume. We really want to make sure that we keep stimulating as much as possible. The other big thing that men have messaged me about is optimization of their hair. We all start losing hair follicles as we age, men and women. Men have hormonal changes just as much as women. So as a man ages, they will start seeing a little bit more hair loss. They'll see it in the sink. They'll see it in their brush. They'll feel it. They're concerned about maintaining the hair that they have and keeping it viable and healthy for as long as possible. Things that we can do for a man who's trying to optimize his hair growth cycles are, doing things like PRP, which we draw your blood, we spin it, we take that plasma-rich protein, which has growth factors in, and we re-inject it in. We can do exosome therapy with microneedling. We can do low-level LED lights that stimulate a healthier blood supply. We can always even go to newer procedures such as PRP with MCT. MCT is taking that PRP that's been spun, we draw it up, and then we add it to this device that does what's called photothermal biostimulation. Now it enhances the exosomes, the exosome concentration in your own PRP, which we're finding to be even more effective than all the other things that we've seen to date. Now, I know I've talked about exosomes, I've talked about PRP, you can go back and look at some of my videos, but this is evolution. This is new technology that has recently arrived in Canada and is approved for injection. I'm giving that one a thumbs up, and I'm really excited as I'm seeing some great results. We've talked about what you can do at home, the essentials with skincare, but now is the essentials of lifestyle. So, preserving your health, keeping a good healthy weight, making sure you have a well-balanced diet. We want to preserve muscle mass. So cardiovascular workouts as well as weight training is key. This is key to keeping all our muscle fibers circulating with fresh blood, building muscle, because over time, you are going to lose muscle mass the same as women who enter into perimenopause or menopause. I don't know if you've heard this word, but there is a word or a condition called andropause, and that is basically a man's menopause. So these are things that you need to do to preserve your overall skin health, but also your own health. In conclusion, the best anti-aging approach for men in their 40s and 50s is a combination of medical grade skincare, maybe some Botox and dermal fillers, definitely some technology treatments such as microfocused ultrasound, radio frequency, maybe PRP with microneedling or exosomes, but most of all, keeping your lifestyle as healthy as possible. I want to thank you very much for watching my video. I'm going to ask you to give me a thumbs up and subscribe. And if you have any questions at all, don't be afraid to DM me or send me a message within the comments. See you next time.